Hello everyone, how are you all doing? Type in the chat if you can see my screen right now. Hello, awesome. Where's everyone tuning in from? Okay, perfect. So I think it's Saturday morning right now in the UK. Excellent. Yeah, I'm in England too, in London right now. I mean, Lacey's asking about the quiz at the end of the month. I'm not actually familiar. I think I'll find out on Monday and I'll let you know. So I'm doing today's session, and then I think Dr. Muzzy is doing the future one, I believe. But we alternate. So he's done two sessions for you guys now. I think I'm due to do two, and then we alternate. We went to medical school together. Cool. All right, guys. So we only have an hour today, so we might as well jump right in. So in today's session, we're gonna look at a few scans, but the context of looking at these scans is that we're gonna try and understand how we diagnose brain bleeds, which are some of the most fascinating things that can happen to your body and ones that require basically life-saving surgery. So we'll also have a look at some life-saving surgery at the end of this session. And we're also going to look at how complex neuroanatomy is, which is how the brain is structured, basically. So there is a Menti code. I'll type it in later, but these are the objectives for today. So we're going to look at the nervous system. We're going to look at the anatomy of the nervous system, and then we're going to use a few tools to help us diagnose um, problems with the neurovascular system. And then we're going to solve some cases together. So that's the plan. And this is the Menti code. So if you guys don't mind jumping on this, I'll also post it in the chat so you guys will all have it. The code's here, 68206671. Yeah, we will end at 11. Okay, so I think everyone should be in by now. So let's talk about the nervous system. So the nervous system is one of the most fascinating body systems. It's the major controlling, regulatory, and communicative system in the body. And it's composed of around a network of neurons, and there's around 100 billion of them, which are all interconnected. So actually, the nervous system, in some ways, is more complicated than the entirety of the internet because there's so many different neurons that all can interconnect. So it's a very, very complicated system. Now, what do you guys think are the roles of the nervous system? Feel, excellent. Okay, send signals, very good. Messaging, excellent. Some very good answers in the Menti. Wow. So yeah, well done. So there's a lot of answers there. So very, very well done. Essentially, the nervous system, you can split its function into three main categories. So this is sensory, so like feeling or the sense of taste. These are sensory functions. Then you have the integrative, which means basically connecting different parts of the body together. And then motor, which basically means movement. So these are the three main functions of the nervous system. But obviously there's a lot more that goes into this, but this is just broad categories. So what does the fundamental unit of the brain look like? So it's a neuron. So this is what a neuron looks like. And you can see the neuron has kind of a head, or we like a dendrite, and a cell body. So these are basic connections are forward looking. You have the axon body, which is where signal travels. So electrical signal travels down this. And then you have the axon terminal where you have multiple connections as well. And you can see there's so many different connection points, and that's what makes the nervous system so remarkable and so complicated. And then you have different parts of the brain that we broadly split into gray and white matter. So the gray matter contains the cell bodies, dendrites, and the axon terminals. And this is where all the synapses are. And then the white matter is made up of the axons, which connect different parts of gray matter to each other. And basically, the gray matter areas and the white matter areas, they communicate together. And I'll show you what that means on a scan. It's difficult to appreciate talking about it like this, but I'm going to show you on a scan, you'll be able to see the difference in the gray and white matter. And then we have components of the brain. So we can split the brain into three main components. Now, there's many, many different components on top of this, but this is just broadly speaking, because there's other bodies that do different things. There's the pineal body, which regulates your sleep cycle, for example. There's so many different bodies, the basal ganglia that regulate your movement. But broadly, we can say there is a cerebrum, which is called the cerebral cortex. There's a cerebellum, and there is the brainstem. So there's three main parts. This cerebrum is the most complicated part. This is what makes us human. This is how we think, and we're able to have executive function. We're able to plan things ahead. We're able to have memory. So the cerebrum is what makes us humans. We have the most complicated cerebral cortex of any animal. The cerebellum is the most primitive part of the brain, and that's also called the hindbrain, and it sits right at the back of your brain, and it basically regulates balance. And then the brainstem is the most vital part of your brain. Your brainstem basically controls your breathing, your heart rate, your consciousness level. It controls all the vital functions that allow you to survive. Okay, so these are broadly the main parts of the brainstem, of the brain, sorry. So what is the cerebrum? The cerebrum is the large outer part of the brain. It controls reading, thinking, learning, speech, emotions, and planned muscle movements. It also controls senses, and it's divided into two different hemispheres, which are basically different halves. You have the left side and the right side of the brain. And what's very fascinating is that the left and right side of the brain are not perfectly symmetrical. They have different functions. So the right half controls the left side of the body. Remember that, by the way, because when we move on to cases, it helps us to know this. And then the left half controls the right side of the body. And each hemisphere has four different lobes. And I'll show you all these lobes in a second. And these are what the lobes each do. So you can see that we have four different lobes. We have the frontal lobe, which is mainly to do with motor function, so movement, because the premotor cortex is there. We have problem solving, the prefrontal cortex, and then we also have speech production in the frontal lobe. I think Yin Ying is asking a question. Do you want to ask it in the chat, or do you want me to unmute you? Let me see. A bit fast. Oh yeah, don't worry, Sufyan. So I'll actually go over this again in a second. I'm only just going through this bit quickly because I want to show you in 3D. So that's why I'm going over it quickly, but don't worry. So yeah, so the frontal lobe, remember, is motor function, problem solving, and speech production. Then the parietal lobe, which sits just behind it, um, is for touch or proprioception and body orientation. Iman's asking, can you grow your brain? That's a very good question. So do you mean in terms of like learning new skill sets? Um, so actually now studies have shown that the brain has this plasticity, which means that, there's this common misnomer that, oh, you can only learn things when you're young. When you're older, it's difficult to learn new things. Well, actually, that's completely false. Your brain has this plasticity, so it's able to absorb new knowledge over time, and it can do this at any age. Your brain is generally more plastic when you're younger because your neurons are all trying to connect to each other. But as you get older, you can also do this. So you can keep learning and grow your brain, as I say, at any age. But actually, you'll also realize that I've reviewed so many different scans of the brain, and you realize that the actual brain size does not correlate to your IQ. So there's people with very big brains that mm, not necessarily have high IQ, and there's people that have small brains that have high IQ. So it's also fascinating in that way. Um, the occipital lobe sits behind the parietal lobe, and that's mainly for vision and visual reception and interpretation. And then you have the temporal lobe, which is by your temples. So it's here, and it's mainly to do with auditory processing, language comprehension. So the frontal lobe is language, like speech production, and the temporal lobe is language comprehension. There's a distinction there. And then memory and information retrieval. And then remember, you also have your cerebellum, which is at the back, which is mainly balance and coordination. And then your brainstem, which basically controls your body. Um, and you need this to survive. So this is your brainstem here. So this is it, widely speaking. Now, let's talk about the brainstem. So the brainstem is at the bottom of the brain, and it connects the cerebrum and spinal cord. And it's divided into three main parts. You don't need to know this, but it's just for your reference. There's the midbrain, the pons, and the medulla. And it controls all the fundamental body functions like breathing, eye movements, blood pressure, heartbeat, and swallowing. So it's very vital that your brainstem works. And most of the cranial nerves, so all the nerves that control your face and your head and neck, originate from the brainstem as well. You can see them coming out here. And then we have the cerebellum. So that is one of the most primitive parts of your brain. It's found in the back of the brain. It controls balance, coordination, and fine muscle control, like walking. It also functions to maintain posture and equilibrium. Yes, was a good question. Does ALS mainly affect the brainstem? So ALS affects the motor neurons, and that's why you over time you become paralyzed. And what is the spinal cord? The spinal cord is a tubular bundle of nervous tissue that basically extends from the brainstem all the way down. It's like a motorway of all these different nerves. And it basically controls the whole body. Okay, so you have all the nerves coming down into the spinal cord, and then they then shoot off to different parts of the body. And then the thing is with the spinal cord is that it reaches a level in your spine to L2, and then it just becomes kind of like what we call the horse's tail, which is called the cauda equina, which I'll show you this on the scan. It's easier to see this on the anatomy app than on here. Okay, but this is basically what the spinal cord looks like. And then what are the cranial nerves? The cranial nerves are basically the pairs of nerves that control different parts of your head, neck, and body. There's 12 of them, 12 on the left and 12 on the right. And their functions can be basically categorized into either being sensory or touch. So sensory, sorry, or motor. And then the brain, because it's such an important organ, it has a very complex circulation. So you have circulation from the internal carotid artery and also the external carotid. And it supplies the brain with blood, basically. So this is called the circle of life, or the circle of Willis, where all the major blood supply to the brain merge. So it's very important to know about the blood supply to the brain. Okay, now last question for you guys before we move on to having a look at the brain. So what protects the nervous system? Well done, Anton. So these are the cranial nerves. Well done. Now that's a good question. What does it mean when you are brain dead? So when you're brain dead, it basically is a way of testing death, and essentially what we test for is the reflexes. So remember the brainstem, it controls your reflexes. Like for example, when you shine light into someone's eyes, that's one of the reflexes. Your eyes should constrict. So these are brainstem reflexes. And when someone's brainstem dead, it means their brainstem's not working. It basically means they're dead. There's no survival from that. Excellent. So well done. So the three main things that protect the brain is or the nervous system is the bone. So you have the skull. You also have tissue, so the meninges, which is the layer lining the brain, and then you also have the cerebrospinal fluid, which circulates around the brain. So there's three different things that kind of protect the brain, because the brain needs to be very well protected. So if you're asking, what is the cerebrum again? The cerebrum is the cerebral cortex. It's the same thing. It's just a different name for it. It's a cortex. We call it the cortex. It's the most complex part of your brain. Perfect. Okay, so now let's have a look at all of this in 3D format. So let me know when you can see my screen. Can you guys see my screen right now? Let me see the chat. Excellent. Okay, so this is what the human body looks like when you remove the skin. And if we remove the skeleton, so first of all, let's have a look at the skull. So this is the skull that protects the brain underneath. And you can see the skull has these lines here. Can you guys see these lines? These are called fissures. So essentially, when you're born, your skull isn't one bone by itself. It's actually multiple bones that fuse together. By the age of around 3 years old, they should all have fused together. Okay, so these are what we call the fissure lines, and you can see that you have the frontal bone here. This is a frontal bone. Then behind it, you have the parietal bone, the occipital bone, and also the temporal bone, and also there's this femur bone. So you can see all these different bones, they merge together. And actually, if you look very closely, can you guys see here? This is an area with a lot of different fissures coming together. This area here is called the pterion, and this is actually your natural area of weakness here. So any kind of trauma to this area can be very, very dangerous, because also there's a blood vessel that runs underneath here, called the middle meningeal artery. And therefore, if you get hit here around the side of the temple, you can potentially end up having a brain bleed. Okay, so this is the pterion. Just remember this area, it's an area of weakness. Okay. And then also you have all these facial bones here. So you have the maxilla, for example, you have the mandible, you have all these frontal bones as well, facial bones. But the mainly the skull is protecting the brain. And then do you guys know what's protecting the spinal cord? Yeah, good, the spine. But what do we call what's the spine made of? Vertebrae, excellent. So you have these vertebrae that basically make up the spine, and they protect your spinal cord. So the vertebrae have different levels, by the way. So at the top here, anyone know what we call the ones in your neck? They have a specific name to them. There's 7 of them. The C spine, excellent. So that's called the cervical spine here. There's 7 of these vertebrae, okay? Then as I go down, you have the ones that connect to your ribs. Anyone know what these are called? Oh, excellent. Well done. You guys know thoracic. So these are the thoracic vertebrae, and each one connects to a rib. Anyone know how many thoracic vertebrae we have? Yeah, excellent. Well done, Ryan. So, well done, Eknor. Well done, Iman. So we have 12 of them because we also have 12 ribs, remember? And then as I go down, we then have the ones in your lower back. This is a lumbar level. Excellent. So these are lumbar vertebrae. And can you see the lumbar vertebrae are actually much bigger in size than the other vertebrae above them? Anyone know why? Why is the lumbar vertebrae so big? Yeah, excellent, because they have to support the whole body. So that's why they're bigger. And then as I go down, you then have your sacral vertebrae, which are all fused together generally. And then you also have your tailbone, which is called the coccyx. Okay, so these are the bones that protect the central nervous system. So now if I remove the bone, we then manage to see the central nervous system. So this is what your central nervous system looks like. And actually all the other organs in your body are there to support and provide nutrition and help this organ system here. So basically, if we just look at ourselves and see what is humanity, this is what we are. We're basically a bunch of neurons that then need supplies to exist. Okay, so this is our main component. And yes, you can see actually one of the nerves is wiggling. Anyone know which nerve this is? Why is this nerve moving like that? Yeah, this is the nerve supplying the heart. That's why it's moving like that. Cool. Okay, so now let's have a look at the brain. So if we zoom in closer, we now start to see, so this here is called the cerebral cortex. Can you guys see it's different to this bit here? This bit is the hindbrain. This bit is the cerebral cortex. This is what makes us human. Okay, anyone remember what this bit was called, by the way? The bit at the back? Cerebellum, excellent, well done. So this is the most primitive part of your brain and controls balance and coordination. And then you have the cortex. So this is the cortex. It's surrounded by the meninges. So if I remove it, you'll be able to see now. This bit is surrounded by the meninges. This isn't. And you can see it's got many kind of hills and troughs. Anyone can see that? Anyone know why? Why do we have these hills and troughs, and why is it orientated in this way? Yeah, well done, Hong. Very well done. So it's to increase surface area to pack in as many neurons as possible in this area. Okay, so that's why we need a large surface area. Excellent. So the cortex is split into 4 different lobes. So at the front, you have the frontal lobe, and it extends to around here. Then behind it, you have the parietal lobe. Then in the back of your brain, you have the occipital lobe. And then near your temples, you have your temporal lobe. So these are the 4 main lobes of the brain. And each lobe then itself has many different nuclei, which help with different functions. So for example, the frontal lobe has the prefrontal premotor cortex, which is here. It's to basically control your body. It's got the Broca's region. It's got different regions, okay? So let me now remove this bit, and I'll show you what's inside the brain. So inside the brain, where all the cerebral cortex has been removed, you can also see there's different nuclei here. So for example, there's the basal ganglia, there's a hippocampus, there's the amygdala, there's a pineal gland. There's all these different areas of the brain that also have different functions as well. But in general, it's so complicated that I think in a 1-hour session, we can't really touch upon these topics because we're still actually trying to understand the functions of some of these nuclei. Like we know broadly what they might do, but we're still trying to understand what they do. So when you guys probably go into medical school, you're still probably discovering things about the brain that we don't know yet, because it's very, very complicated. But that's what makes science very interesting, right? Because we don't know all the answers yet. And we don't know, for example, how dreams are formed or how memories are formed, things like that. Like it's very complicated. Josh was asking, is the hypothalamus for temperature and water regulation? So yeah, well done. So the hypothalamus is the master regulator organ. Actually, it regulates all the hormones in your body. And you might think that the hypothalamus, because it regulates all the hormones in your body, it's a master regulator gland, it must be such a big organ. Do you guys know how big the hypothalamus is? Do you want to see how big it is? So it's actually even smaller than a bean. So this bit here, this tiny, tiny, tiny body here is called the hypothalamus. Just this bit. Okay, and then this bit here, this is called the pituitary gland. Have you guys heard of the pituitary gland? The one that secretes all the hormones that regulate parts of the body. So that's how small it is. Can you guys see how small it is? It's literally smaller than your lacrimal gland, which is the gland that produces tears. That's how small it is. But this, if you don't have it, you survival will be very difficult. Imagine this tiny nucleus, it regulates everything, all the hormones in your body. So this is what I mean. The brain is very complicated, okay? So even very tiny structures do a lot of things, okay? So this is what I'm trying to get at. It's very complicated. But what's interesting is that we're learning new things about the brain, and it's a area of a lot of research. Okay, now we also can see the cranial nerves here. Can you guys see the brainstem? So this bit here is called the brainstem. And you can see the nerves coming out the brainstem. So let me actually show you better. So you can see, for example, this nerve here, it goes to your eyes. Anyone know what nerve this is called here? It goes to your eye? Optic, yeah, well done. Very good. Let me test you one other one. So this is the first cranial nerve. So the second one's the optic nerve. The first cranial nerve is the one right at the top here. Anyone know what function this one has? And actually, it's one of the most important ones that activates memory. Yeah, well done. Smell. So this is called the olfactory nerve, and it controls your sense of smell. And the reason why it's a very powerful stimulator of memory is because it's right next to the hippocampus. The hippocampus sits here. So actually, have you guys ever had this feeling when you smell something and you get deja vu? Anyone know what deja vu is? It's like you have a feeling that you've come across this before, a feeling of deja vu. So actually, the sense of smell is a very powerful trigger for deja vu because it's sitting next to the memories, your place where you store your memories. Um, so actually, if you want to revise for exams and there's, say, a fact that you really can't struggle to remember, memorize that fact while smelling something very peculiar. And then that smell will then trigger the onset of that memory. You can try it. And by the way, that's why also during COVID, when people lost their sense of smell, they felt really bad. They couldn't, for example, also their sense of taste went as well, because your sense of smell also determines how you taste things as well. So the brain is very, very complicated. Okay, so these are the different parts of your brain. So we've touched upon that. So now let's go back and have a look at some cases. So we've seen this now. So now a question for you guys is, when we have problems with the brain, how do we investigate them? Can you guys see the Menti now? Oh no. Can you guys see my screen? No, yes, no. what can you guys see then? Oh, you're still on anatomy. Let me stop sharing. Let's try again. What about now? Okay, cool, perfect. So there are loads of different things to investigate the brain, but mainly we use scans to look at the brain. So let's have a look at what a normal scan looks like. So let me show you guys what a scan looks like. So this is what we call a CT scan. So this is a scan that we make using X-rays. So have you guys seen when we do like a chest X-ray? So you know these kind of scans are all X-rays as well. But the difference is with these kind of scans is that we have a 2D model. This we use a 3D scanner. So we shine X-ray energy in three dimensions, and then we generate a scan. So computer makes a scan. And the idea of the scan is that different tissues will absorb X-ray energy differently. So for example, bone, it's very, very dense. So therefore it absorbs all the X-ray energy and therefore it looks white on a CT scan. And then different parts of the brain will absorb it differently. So for example, you can see this black stuff here. Can you guys see this dark stuff here? Anyone know what this is here? This is not air in your lungs. Sorry, in your brain. Anyone know what this is? It's not blood. It's fluid. Excellent. Well done, Dan. So this is cerebrospinal fluid. These are called your ventricles, and these are full of fluid. And you can see the fluid surrounding the brain as well. So this dark stuff is fluid, cerebrospinal fluid. The ventricles, Joshua, are where we have these are structures that basically circulate the cerebrospinal fluid around the body. So you have the lateral ventricles, you have the fourth ventricle, and you have all these different ventricles, okay? So the fluid is called cerebrospinal fluid. Okay, and it's inside the ventricles. These are called the ventricles. Not like the ventricles in your heart. They're ventricles in your brain. Okay, and you can see that different parts of your brain absorb X-ray energy differently. So for example, can you guys see there's a different shade of gray here? There's a lighter shade and a darker shade. Perfect. So this is actually what we mean by gray and white matter, okay? So actually, it's a bit confusing, okay? But the bit that looks darker on this is actually the white matter, and then the bit that looks lighter is the gray matter. Because on a CT scan, it's like the opposite of what it is in when you dissect when you actually dissect the brain in real life, what you see is that this bit is actually more white because it has myelin, but on a scan it looks different. Okay, that's why there's this misnomer. Okay, that's why we called it differently. But myelin, so myelin, Sufyan, is the covering of the axons that basically allows electrical signal to go very fast on the in the axons. And actually, when you have a problem with myelin, anyone know when you have a problem with myelin sheath, what disease you can get? There's a very common disease. Yes, it's called multiple sclerosis. When you have damage to the myelin layers, usually it's autoimmune, so the immune system attacks the myelin sheath, and then you're not able to, your neurons don't function as well, and therefore you start to have symptoms. Okay, you start to have weaknesses, for example. So you can see here that there's a differentiation. There's a white matter, gray matter. So the gray matter is basically on the outside, and the white matter is basically all the axons that take signal from the gray matter to different parts of the brain. Okay. So Parkinson's is a slightly different disease. Parkinson's affects the basal ganglia, your dopamine, basically neurons, and basically affects movement, affects areas here, basically. So this is what a normal scan looks like. You can see the brain is split into two different hemispheres. So in fact, let me label this. So this bit here, this is, in fact, that was a bit. So this bit here This is the right side, okay? And this bit here is the left-hand side, because essentially the way you're looking at a scan is that you're looking at the patient from the feet upwards, as if they're lying flat. So this is the right-hand side, this is the left-hand side. This is the right hemisphere, left hemisphere. And you're right, there is a bit of the brain that connects the two. You can see it. In fact, I'll show you on an MRI scan because it's easier to see. Okay, but there is an area that connects the brains. It's called the corpus callosum. Well done. So when you're looking at a scan, what you're looking for is you try and look at all the different lobes and try and see whether the brain looks more or less symmetrical, because the brain should look more or less symmetrical. And remember that if a patient's having symptoms, so say the patient has come in with left-sided weakness, which part of the brain is affected? Is it the left side or the right side? Right side. Well done. So remember, whenever a patient comes in with left-sided symptoms, you have to look on the right side of the brain. Okay, so just remember that. So this is the right side. And this is what a normal scan looks like. Okay. You can see that the brain's fairly symmetrical. You can see these are the different cerebral corti. And if I go down, we start to see this Mickey Mouse shaped. Can you guys see this here? Anyone know what this is here? Right in the middle of the brain, one of the most important parts of your brain. So this is the brainstem here. This is the brainstem, and then that then becomes your spinal cord. Okay, so this is your brainstem here, and at the back of your brain here you have the cerebellum. Okay, this is the cerebellum, and you can. What's good about CT scans that you can look at it from different angles as well. So this is a different angle of the scan. Okay, see this is what area is this? Anyone know in the chat? Cerebellum, excellent. Which part of the brain is this here? Cerebrum, excellent. But which part? Frontal lobe, excellent. Well done. Which part of the brain is this? The brainstem, excellent. And then this bit here that comes from the brainstem, what bit is this? Spinal cord, excellent. Well done. There's also a different type of scan that we can do to look at the brain, and it gives us a lot more detail. Anyone know what type of scan this is called here? So this is a more complicated scan. It takes longer to do, and it's more expensive. Therefore, generally, when we start off investigating a patient, we generally start off with a CT scan, and then we do an MRI. So this is what an MRI scan looks like. So this kind of scan utilizes very, very powerful magnets. Magnets are 20,000 times more powerful than the Earth's gravity, okay? And you can see, you can actually see so much detail. And you're completely right, Mohammed, that this is, Yasma, this is actually a child. Can you guys see? This is actually a MRI scan of a child. Anyone know why we're doing an MRI scan for a child rather than a CT scan? Anyone know? Yeah, excellent. So basically, the CT scan has that risk of radiation, and we use X-rays. So therefore, in children, we prefer to do MRI scans because it's there's no X-ray radiation risk there. And you can actually see all the different parts of the brain here. What part of the brain is this here? Cerebellum, excellent. Then what part is this here? Excellent, the brainstem. What part of the body is this here? And you put a label. Anyone know? So that's called your lingua, and it's your tongue. It's one of the most powerful muscles in your body. Can you guys see it's the tongue? Can you guys see that? If I move it, you can see muscle. And then you can also see all the vertebrae here. You can see the vertebrae, the spinal cord. You can see the eyes. Can you guys see that? And then you can also, on the MRI scan, you can even make out what their facial structure and things like that. So can you guys see that? So MRI scan gives us a very um, detailed picture of the brain, basically. And here you can also make out, can you guys see that there's a difference in color here? So what do we call this area of the cortex? The dark area, the white matter. Excellent, well done. And then the outer bit is the gray matter. And can you guys see this white stuff here? On an MRI scan, the white stuff is fluid. Okay, so well, depending which sequence you do for MRI, but generally the white stuff is fluid. So these are the ventricles. And you can see the fluid surrounds the brain as well. Millennials think very good question. So when would you use an MRI scan and when a CT scan? So generally, when you investigate a brain problem, we start off with a CT scan because it's quick to do. It gives us a quick solution. And then if we need more detail, we do an MRI scan. In things like when we suspect a brain bleed, we do a CT scan because brain bleeds, you can easily see them on a CT scan. Okay. And yeah, this is basically your body. Okay, cool. So let's now have a look at some cases together. So case one is a 35-year-old patient who's involved in a road traffic accident. He presents with worsening headache and a reduced GCS score. So good question. What is a GCS score? So it's a Glasgow Coma Scale score, and it looks at your consciousness level. So what do we do with this patient? By the way, the Glasgow Coma Scale is formed of 3 different components. So it looks at your movement, it looks at your eye movement, and also looks at speech. So well done, everyone. So you have to admit this patient and investigate further. Telling the patient to go home and visit their GP, you might be putting the patient at risk because we're suspecting something more serious here. So now on your Menti, you should be able to see this patient's scan. So what do you guys think of this patient's scan? Let me know if you can see it, by the way, or not. You don't see anything. Okay. Well, let me show you then. So this is a patient scan. Actually, wait. This is it. This is a patient scan. So what do you guys think? Normal, abnormal? If you think it's abnormal, then which part is abnormal? Yeah, well done. So I really like that you said the right side. Excellent. Well done. So yeah, so actually this is very bad. What's happening is that the brain bleed, and it's the reason why brain bleeds are bad is because your brain is in this very tight area called the cranium, right? There's this theory called intracranial pressure. So basically, if you have bleeding there, then you are compressing on the main brain structures. So can you guys see we're compressing here? It's going like this. So the right side is compressing onto the left-hand side. You can see that the bit is not straight anymore. We're compressing that way. And then also what we're doing is we're compressing on other vital structures of the brain. So can you guys see we're compressing on the brainstem as well? Can you guys see the brainstem here? Doesn't have much space. So this is why this patient is getting unconscious. There's compression on the brain. Okay, so this is bad news. So what do we do? Done that. So let's have a look. Lena's asking, is this where you have an aneurysm where you don't cut the skull open? Oh, there is some types of surgery that you do. That's done by the interventional radiologist. You're right. So you can stop aneurysms by using wires. But we'll talk about aneurysms in a different session, I think. Or actually, there might be a case of aneurysms later. So this patient basically had what we call an extradural hemorrhage. And this is an acute hemorrhage, which is bleed between the dura mater and the inner surface of the skull. And it can cause compression of local brain structures and the rise of intracranial pressure. And if the intracranial pressure continues to rise, then you get cerebral herniation, and this might cause brainstem death. And most commonly affected are actually adult males between the age of 20 and 30. I think it's because those are demographic that are usually involved in major trauma. So that's probably why. And patients basically experience a loss of consciousness at the time of head injury, followed by a lucid interval where they feel okay. And then suddenly they deteriorate and they lose consciousness again because the hematoma is forming and getting bigger. Josh was asking, what does extradural mean? Extradural means it's outside the dura mater. Do you guys remember the dura mater? The meninges, the layer of the meninges, there's different parts of the meninges. One of them is called the dura mater. Oh, I think I've lost the screen here. Can you guys see the screen? Yeah, well done, Mohammed. So the dura arachnoid PM. Okay, so do you guys want to see how we get rid of a bleed like this? Do you guys want to see that? It's quite gruesome. It's early in the morning. Type in the chat if you want to see it. Okay, come on then. Let's see this in 4K. So let me exit this. So now we're going to see evacuation of a left-sided epidural. Okay, so in our patient, it was right-sided. In this patient, can anyone see where it is? Where is the bleed here? I mean, it's quite difficult to see, but can anyone see it? I'll point it out to you. It's right here. Can you guys see this area here? Sorry, this circle was a bit wild, but this area here is the bleeding. It's quite extensive, right? So let's have a look now at how this neurosurgeon is going to operate on this patient. So by the way, neurosurgery is such a fascinating part of surgery because these guys are actually saving lives. So the first part of the video is actually the neurosurgeon.
Getting it closed up. Should take about 60 minutes or so.
To try and get to the
we'll be able to see.
And then the patient's on the theater. And now what we see here is the patient is draped. This is the skull. It's already been shaved, by the way. So we've removed all the hair. And then we made a marking to where the surgeon wants to make incisions to remove the skull and then find the bleeding. Okay? So let's follow this along. By the way, this is all sterile.
Kerosene. Yeah, I don't think we're gonna need that.
You can see the surgeon is looking through the skin. The skin layer is bleeding at the moment. But that's fine. It's very minimal.
Let me have Rainies.
Sufyan, I'm very sorry that you're eating right now.
Right back in a minute.
By the way, if this patient doesn't undergo this operation, then they will die. So this is literally life-saving. Okay, so the green bit are basically.
This woman's very malnourished, obviously.
Allow for a skin flap. So basically, we're going to flap that over, and then you'll expose the layers of the skull. So here we can see the skin. We're removing the skin from the bone. The bone here.
That's beautiful.
Everyone's asking, will they go to jail if the patient dies? No, this is you're saving their life. So nothing happens. If they die, then it's a complication of having a brain.
While we're doing this, let me have the
very sad, but that's how.
I'm gonna put a hole back here.
You're saving them. So then what we're going to do is we're going to cut into the bone. So can you guys see we're using a special drill. So this is called a stereotactic drill. This drill only drills into bone. It stops as soon as it hits soft tissue, it stops. So we're drilling into bone right now. And we're making this thing called a burr hole.
There's epidural right there. Let me see a curette, please.
And there we go. We have a burr hole now.
Thank you.
Why is it white? This is bone. Remember, that's why it's white. And then what we're going to do is we're going to make multiple burr holes.
If you can, retract it.
So we're making multiple. We've made one burr hole here, one burr hole here, one burr hole here. So what we're going to do is we're going to cut between them. So we're sawing between the burr holes to try and expose the brain. Yes, the patient's under is asleep right now, under anesthesia. And you'll see how we repair this girl, so I'll show you.
That's a little bit. Yeah, you don't feel crazy.
And you can see it's getting through it. And then we're almost done now. So last bit now, and then we're going to expose the brain. So now you can see we've got the skull flap. We're going to move the skull flap away, and there you go. You can now see the area of bleeding on the brain.
Some bone wax, please. Actually, you know what?
And now what we're doing is we're going to try and find the bleeding vessel and cauterize it so it stops bleeding. And by the way, Fatima is asking, how is he so fast with this? So the thing is, remember, you're literally saving someone's life. As the patient continues to bleed, time is brain, you're damaging more brain. So that's why this has to be
well, there's no mystery here. It's a big epidural.
Can you guys see what this is?
It's a big one. Okay. Clean this up. Let me have an elevator, please. Periosteal elevator. Let's get rid of this.
And this is a massive blood clot. Can you guys see how big that is? That's a huge blood clot here.
Get rid of that.
It's dark, like jelly. We're removing that. We're going to clean the area. The bleeding has been stopped now. You can see there's no more bleeding. The brain's been saved. And then what we're going to do is we're going to put everything back together. So the surgeon is carefully stitching, like suturing the brain back together, the layers of the brain. And then we're going to attach the skull flap back on. We're going to use screws. I'll take screws. Can you guys see we've put screws there, placement screws, and we're gonna put it back on.
That'll do it. Let me have drill.
We're literally using a screwdriver here.
Okay, good. Let's get another.
Interesting, right? So this is life-saving surgery, and to become a neurosurgeon is actually such an investment. Like it's such a difficult career pathway because you're dealing with one of the most complicated body parts, and the way you operate, I have a huge admiration for brain surgeons. I'm not, but one of my best friends is, and he's such a cool guy. He's the only person I trust to operate on me because he's such a legend. Out of my friends, I mean, because I mean, I'd probably also trust Dr. Muzzy, but he doesn't operate, so that was that. So now let's have a look. We actually don't have that much time, but let's quickly do case 2. So case 2 is an 86-year-old patient who presents with 1 month history of increasing confusion and admitted 6 weeks ago for a fall. And with this patient, what's happened is this is what we call a chronic subdural. So this is a slower bleed. Usually an extradural is an artery bleeding. This is a vein bleeding, so it takes longer to manifest. And therefore, what happens is over time you get symptoms. So it's very gradual. Whereas an extradural, when it's an artery bleeding, your symptoms are very quick. But this is very slow because it happens over many weeks or months. Okay, so a build-up um, of blood. And in this case, usually with subdurals, because it's a vein bleeding and it's over time, we generally don't need to do an emergency craniotomy. We can actually observe and wait for the bleeding to resolve by itself. Okay, so that's why it's both of these answers are correct. Okay, you can either observe or you can do craniotomy as well if you want to. Okay, but generally we don't rush into operating on those kind of bleeds. Okay, cool. So let me show you guys a few more situations. So this is an example of a subarachnoid hemorrhage. This is a different type of hemorrhage. And this hemorrhage is when you have an artery and part of the artery, you have a balloon in there called an aneurysm. And this sometimes can puncture. If this gets bigger and bigger, imagine arterial blood's under a lot of pressure. If this gets bigger and bigger and it ruptures, then you have a massive bleed. And this is called a subarachnoid bleed. And I should ask a good question. What causes aneurysms? Generally, you're born with it. So you don't actually know, but you might have this ticking time bomb in your brain, that little aneurysm that might grow and grow. There are risk factors, but generally people don't know they have this. And then suddenly they present with a very sharp headache and they have an aneurysm. And actually, there is a risk factor. So can you guys see on your screen these kidneys? What's wrong with these kidneys? Yeah, they have bubbles. Can you guys see these bubbles in these kidneys? Anyone know what these bubbles are called? There's a fancy term for them. Not clots, they're called cysts. So this patient has what we call polycystic kidney disease. Anyone heard of that disease? Polycystic kidney disease? So with that disease, you actually have a much higher predisposition to developing aneurysms. So let me show you actually. So this patient here, this is another CT scan looking at the abdomen here. And you can see, can you guys see this structure here? That's a kidney, and this is the other kidney. So this patient has polycystic kidney disease, and it's everywhere. The kidneys are so huge, and they've got loads of cysts. And when you have a polycystic kidney disease, you're more predisposed to developing an acute blood bleed from the berry aneurysm, which is like an aneurysm in your brain. So to summarize, there are three main types of brain bleeds. There is the subarachnoid, which is basically when you have a berry aneurysm that ruptures. There's a subdural, which is basically from the veins that bleed. It usually happens in the elderly, and it basically resolves over time where you need to do an operation. And then extradural or epidural, these are after you have trauma. Okay, and you have a bleed that then has to be operated on. Excellent. So I think that brings us to the end of today's session. I think there's a lot to cover there, but I hope you guys found it interesting. I mean, the brain, basically the takeaway is that the brain is such a fascinating structure. There's a lot to learn there, and neurosurgery is just awesome, and scans help us diagnose patients, basically. There'll be a session on Monday as well, which I'll be there as well. So hopefully see you guys on Monday. And if you have any questions from today's session on Monday, I'm more than willing to help you then as well, because I think today's session is meant to be only an hour, but on Monday's session is slightly longer. So I've got more time to help you. Perfect. Well, thank you, everyone. Have a great Saturday, and I'll see you all on Monday. Bye, everyone.